Today we're at Memorial Cancer Institute. Behind me is the Memorial Breast Cancer Center, and we're about to meet Dr. Rueth. She's the Chief of Breast Cancer Services here, and she's going to talk to us about early detection and effective treatment. I'm now joined by Dr. Rueth. Doctor, thanks for being with us today.
Oh, it's my pleasure. Thank you so much for the opportunity to talk about this. It's always something that's very near and dear to our heart in the cancer world.
Certainly. And what's new in this world that people may not be as aware of?
Yeah. So a couple of things happened this year that were fairly critical for breast cancer. A big one was an update to the screening recommendations that just came out from the United States Preventative Services Task Force. So for a long time there was a lot of uncertainty, unclarity as to when women should start being screened for breast cancer. This year, the task force came out and did endorse mammograms starting at the age of 40. For a long time, there was uncertainty. Do we start at 40? Do we start at 50? Do we start even later? The recommendation is now for women to start their screening at the age of 40. So it's been nice to see some consistency around those recommendations. Most of us in breast cancer always endorsed that kind of a timeline, starting at 40.
For individuals who have a history of breast cancer in their family?
That's a great question. It depends on who had cancer and when, so of course nothing can be so straightforward, but in general we recommend starting at 40 or 10 years younger than the first degree relative.
We're in this beautiful facility that's brand new pretty much. What are you able to do here at Memorial that separates you from others?
There's some really great advantages about considering a place like this your home base. This center was designed with the cancer patient in mind. So often we focus on just the chemotherapy, the surgery, the radiation without attention to the rest of the body, mind, and spirit, the things that we need to heal, as well as, really important, our caregivers and our support networks who are also going on this journey with cancer patients. So at a center like this, where we have outstanding medical care all housed under one roof, right? So rather than have to maneuver your way through multiple different institutions, understand your parking, understand what door to go in, where to check in, right? All of these things add stress to a situation that you don't need to deal with when you're stressed about your survivability. So having comprehensive multidisciplinary care under one roof, right, with the patient-centered focus can alleviate some of that stress. And then you add in spaces like meditation spaces, the Center for Body, Mind, and Spirit, where, for example, in the world of breast cancer, we need to think about surgical support items, prostheses, lymphedema garments, wigs, manicures, the things that help cancer patients still feel whole. To be able to do all of that under one roof, to have bright spaces, an outdoor garden, a cafe that focuses on healthy nutrition for patients and their caregivers, all of the little things that we can do to help reduce some of the stress factors that come into the day-to-day of dealing with cancer really help ease that journey.
Well, doctor, thank you so much for your time.
My pleasure. Thank you.